Hi everyone, today I'm here with Dr. Sam Huang, the chair and professor of the Department of Dermatology at UC Davis, and he's been practicing in the academic setting for over 20 years. He's a board-certified dermatologist, and today he's joining us for this interview.
Thank you very much.
Dr. Huang, thank you so much for being with us today.
Mm-hmm.
Before we get into kind of like the details of dermatology, could you briefly give us an overview of what dermatology is, since a lot of people seem to think it's mostly just like acne and like basic skincare?
Dermatology is the field of medical science and practice where we take care of patients with dermatologic or skin diseases. I think what most people don't realize is that skin diseases often reflect systemic diseases, and we are trained to recognize these systemic diseases based on the signs that we see in the skin. I think skin diseases can be broadly divided into two major groups: those that we call inflammatory skin diseases, many people call them rashes, and those that are skin cancers or tumors. And so we spend about an equal amount of time on both of these broad categories, and fortunately most of the skin cancers that we do see are very easily treatable by surgery, but some of them, like melanoma, can lead to fatal results. And so we have to identify these cancers quite early and institute treatment as soon as we can. For the other inflammatory diseases, some of the common ones that people have when they present to us include eczema, they include psoriasis, they include contact allergies to things that we are exposed to in the environment. And we also see diseases like lupus, where there are clearly issues that affect other organs, the kidneys, the brain, the lungs, heart sometimes, and also have very well-recognized skin manifestations that we can help make the diagnosis of and then initiate with our colleagues the right treatment for these patients.
Okay, and so dermatology is a residency that you do right after you finish medical school. Are there different subspecialties of dermatology, and if so, what are they?
Yes, there are different subspecialties of dermatology. Let me address your first question first. Yes, you generally apply to a dermatologic residency during the fourth year of medical school. You have to do an internship before that covers general medicine, and then the program for most dermatology residencies is 3 years long after that. Once you receive that dermatologic training, you can also apply for fellowships in various areas within dermatology. These include pediatric dermatology, dermatopathology, dermatologic surgery, as well as cosmetic dermatology. There are all sorts of different fellowships that one can apply for. They're not formally recognized by the ACGME, but they are meant to give you more in-depth knowledge about other fields within dermatology.
Could you tell us the story of what brought you to medicine, in particular your particular field of dermatology?
I actually didn't know very much about dermatology when I went to medical school. I knew I wanted to be a physician when I entered the course. I was very lucky to have an advisor who was assigned to me who happened to be a dermatologist at Harvard Medical School, and he was one of the influences. I got to know him and got to see what he did, and then when I did my dermatology residency, my dermatology rotations as a medical student, I saw that it was a fascinating field. And one of the great things about dermatology is that what you see on the skin is often reflected in the pathology that you see under the microscope if you were to take a biopsy of the skin. And my other great interest in medical school was pathology, what are the causes of disease, what are the manifestations of the disease at the molecular or cellular level. And that's one of the reasons I did a PhD during medical school, to understand that somewhat better. And so dermatology was a perfect outlet to use that experience in pathology as well as combining with science and clinical medicine.
So what's the typical day like for a dermatologist from when they come in to when you leave, or how is your day like? And then how would that be different than maybe like a dermatologist in a non-academic setting?
I think being in academics, I'm very involved in research, so I spend about a third of my time working with my lab members or evaluating science in some ways through grants or papers. I also, being the chair of the department, I spend a lot of time in administration. I go to meetings to either change or make decisions about policies within the department and at another level with the medical school and with the hospital as well. So I spend about a third of my time in administration, and then about a third of the time I actually spend seeing patients with our residents. And I think the main difference between someone in private practice and someone in academics is that in academics there's usually more research involved. There's also a realization that we have to teach the next generation of dermatologists, and so we spend a lot of time working with our residents, teaching them various aspects of clinical dermatology so that when they are finished with residency they can go out and practice dermatology. In private practice, it tends to be much more focused on clinical care, where 4 to 5 days a week the typical dermatologist would be spending most of that time seeing patients, making callbacks to other referring doctors, or handling some of the administrative needs of a clinical practice.
And what would the hours be like usually?
Well, I think in clinical practice, the hours are usually pretty regular. I would say that most dermatologists in private practice work somewhere on the order of 40 plus hours a week, doing all the things that I mentioned before. In academic dermatology, we tend to work about more or less the same hours, perhaps more in many senses, because of the other obligations we have for teaching and research. So many of us do the research and writing on the weekends or at night, and evenings. Hard to count up those hours, but it probably adds up to a lot more than 40 hours a week for the typical academic dermatologist.
So a lot of people have the kind of notion that dermatology is a lifestyle specialty. How is the lifestyle, is that true first of all, and is the lifestyle different? How is the lifestyle different than that of other specialties?
Well, I would say dermatology differs in that we don't have as many life-threatening emergencies as other fields like cardiology or perhaps surgical fields, where a doctor may be called in the middle of the night, many times often to treat a patient who needs clinical care. We don't need to do that as often as the surgical subspecialties, but on the flip side, there's a lot of demand for dermatology. There are many skin diseases. There's lots of skin cancer in this community as well as many communities around the country. And people realize when they have a skin disease, it's not like cardiology where sometimes you don't know that you have hypertension. But most people do realize that they have a skin disease and they want to be seen and treated by a dermatologist. So we often see on the order of 40 to 60 patients a day in order to make sure our patients have access to dermatologic care. So there's a different kind of pressure for us to be able to see patients quickly and to see them in a way that makes them happy and gets them treated as soon as possible.
What are the most challenging aspects of dermatology?
I think there's a tremendous amount of knowledge required. There are well over 500 different skin diseases that have been sort of named. Number might be closer to 1,000. We don't see those rare diseases on a day-to-day basis, but we have to have an idea of what they are. I mentioned before that we have many patients coming in during the day. That doesn't give us a lot of time to be able to make the diagnosis, so we have to be able to do practice medicine very efficiently. We have to be able to identify the skin disease. We have to be able to do a procedure like a biopsy if that's needed to help us make that diagnosis. And we have to talk to that patient about treatment plans. And we have to do it in a very time-efficient way in most cases so that we can make sure that all the patients who want to see us can get in to see us in a timely way. So that's one of the challenging things, being able to do all of that in a reasonably efficient amount of time. And then we do have to make decisions about care. And there have been lots of advances in dermatology over the last 10 years in terms of treatment, so we have to keep up with those treatments and be able to utilize those treatments and to safely use those and explain how those medications, many of them are injectable medications, are used to treat their dermatologic disease.
Okay, and what's the most rewarding aspect of dermatology?
Well, I think it sort of relates to dermatology being a practice where we can see, patients can see what is affecting their skin, and we can see it in making that diagnosis. But the patients also see when their diseases are getting better. And believe me, many patients are very appreciative of having a skin condition that affects their lives and is easily visible to them and to their relatives or their friends go away in a matter of days or weeks or months, depending on the treatment plan. But they appreciate having that change that is so often visible to the outside world get better over that course of time. And I think dermatologists derive a lot of satisfaction from being able to make a difference in the appearance and outlook of that patient. One may debate this, but the skin is one of our main interfaces of humans from themselves to the outside world. And so that interface, if it's changed in some way, is often recognized as being changed. And people are often affected by that recognition. For example, in countries where patients are darker skinned, if one has vitiligo, a condition where you lose that pigment in the skin, in the hands or the face, it is very, very apparent to other people. And individuals in certain countries are often shunned by others in their society because of that disease that they have no control over. It's an autoimmune condition. But there are ways to treat that disease that we have now that can get the color back into their skin and get these individuals to be back to the normal society that they were part of before they developed that disease. So being able to do that, I think, is one of the great things about dermatology and one of the greatest sources of satisfaction for dermatologists.
What are misconceptions about dermatology? You mentioned before that it's less just like surface, it's more indicative of maybe systemic conditions rather than just like surface level, as some people believe. Are there anything else?
I think that probably is one of the main misconceptions about dermatology, that we treat diseases that are, I would say, not medical in nature, that are cosmetic in nature. Most dermatologists, except for a few who specialize in cosmetic dermatology, actually focus on what I would say is medical disease, whether psoriasis or eczema or other things, other diseases, skin cancers. These are diseases that have a real impact on the health of an individual. One can say that itch may not be a major symptom, but it turns out that itch, which is a symptom that many patients with dermatology disease have, is a major life-changing event. Patients who have severe itching can't sleep, they can't function at work, they tend to perform less well in school. I'm talking about kids and other people who are in school. And they have radically changed lives because of that itching, depending on how severe it is. And so itching, even though some of us may think of it as being a relatively trivial symptom, is actually a major life-changing symptom if it is severe enough. And so the other point is that we treat diseases too. We're often the first to recognize that something more serious is going on, and it's far beyond just the skin. For example, there are some certain signs, certain rashes that occur when patients have cancer internally, and we're often called upon, because people can't see the internal cancer or feel the internal cancer, but they have this severe rash that presents to us and presents to the outside world and to the patient, and we can, based on the look of this rash and doing appropriate biopsies and tests, we can often be the first to let that patient's other doctors know that it's likely that they have an internal cancer, and so then they can begin the kind of CAT scans, PET scans, whatever is necessary to identify the source of that cancer. So that's just one example where dermatologists are often the first to be able to recognize that something quite serious is happening internally in that patient.
And what's the scope of practice difference between dermatologists and, say, other fields like maybe like plastic surgery?
Yeah, there is certainly some overlap. Dermatologists often do some surgery. I would say that the surgery that dermatologists do is mostly limited to skin cancer, to aesthetics, and to the repair of wounds once skin cancer is treated. Other fields like plastic surgery, for example, tends to do bigger operations. They can involve the tendons and nerves, other structures within the skin, as well as other parts of the body that are necessary to perform these larger surgeries. So, but there are many cases where a dermatologist or a plastic surgeon could achieve equal results and would be removing skin cancer, for example, and then repairing the defect after that. The outcome would be pretty much identical in both cases. ENT doctors also overlap in certain ways. On the head and neck, for example, they often do surgeries that a dermatologist could do. So, in many fields of medicine, there are many cases where either field is quite competent to be able to treat those different diseases. But dermatology, as I mentioned before, is the focus is on the skin itself as an organ in health and disease.
Are there certain personality types that are best for dermatology or future dermatologists?
Dermatologists, I've known many dermatologists. The spectrum of personality is enormous, as within most fields of medicine. I wouldn't say there's one type of personality that fits in dermatology. I would say, though, that dermatologists, personality-wise, if there are some trends, they tend to be fairly well-rounded. They tend to like the medical aspect of dermatology, that is the internal medicine part of dermatology, perhaps more than surgeons, who are a little bit more proactive about the procedural parts of medicine. So with rare exceptions, most dermatologists practice internal medicine or dermatology that's considered medical in practice and is not surgical. And then we spend maybe 10 to 20% of our time doing surgical procedures. So I think it is a field where there's a lot of thinking involved. So many of the dermatologists like to be able to think about the systemic disease, all of the symptoms, the manifestations, the pathophysiology of diseases that go into the skin. And so many very, I would say, deep thinkers are going to dermatology, and many folks in dermatology also have an appreciation for aesthetics. That's kind of an interesting thing. A lot of them either like photography or they like the arts, and so many of them will also tell you that they are very visual individuals compared to, say, a cardiologist who likes to look at EKGs or look at echocardiograms. Tends to attract those individuals who have a sense of aesthetics, a sense of the arts, and I can't tell you that many people in dermatology sort of have that kind of interest in the arts. So if I can generalize, that's one of the things I would say.
And since you do work the residency program here, what tips would you give medical students to get into a competitive residency program in dermatology?
Well, I think dermatology is very competitive, probably one of the top 3 most competitive fields in medicine as far as getting into a residency these days. I would say the successful applicants have a number of things in common. They're usually in the top, at least top third of their class, I would say, often in the top 20% or even top 10% of their class. They tend to do relatively well on the USMLE standardized test, Part 1 and Part 2. They also tend these days to have some sort of research experience, either during medical school, where they work part-time and find a mentor to do these projects, or they sometimes take a year off, and they will spend considerable amounts of time during that year off working on quite serious research within dermatology. And so that is a trend that has been occurring for the last 5 years or so, that many of the successful applicants have taken a summer off or part of the year off, or sometimes even a whole year off in order to develop that in-depth knowledge of dermatology and clinical research within dermatology, or basic research within dermatology, in order to make their applications more competitive.
Okay, is there a certain amount of research papers that you recommend having, or?
Well, it's hard to say, but it turns out, I mean, if you look at the statistics, people who are successfully matching dermatology programs typically have at least a couple of papers, and often more than that in the course of their medical school studies or that time off for research. We've seen medical students with 30 publications, for example, and that's probably well on the far side of the spectrum. But I would say most of the successful applicants have at least a couple publications, if not more, where they're either co-author or first author on those publications in a research-related field. It may not be so much the research itself, but it's also a way that you get to know a mentor, and you have someone in the field of dermatology who can write you a very good letter of support. That's very important, and it also allows us to sort of see the depth of one's interest in the field of dermatology and the type of quality they can produce as far as writing, as far as being able to manage research projects, and to be able to perform research at a high level before they get into a residency program.
Moving on to more of the financial aspect, how well are dermatologists compensated generally and compared to other specialties?
There are publications that describe that quite well. It is in the top 10, but it's somewhere between 5 and 10, I believe. Mm-hmm. So in terms of specialty, out of the 30 plus specialties. So it's certainly in the top third of specialists. I think that people mentioned the lifestyle of dermatology, and I had talked about the call schedules and the need to go in late at night, and that tends not to be the case for most dermatologists out in private practice. And so the number of call hours that they take compared to a surgeon is probably fewer than that. And so many people would say that the quality of life within dermatology is quite good. You can work part-time. You can have a family and be able to work in dermatology, and the income is quite good. The compensation, as it is now, is quite good because of the demand for dermatology services and the need for them in the community.
As a dermatologist, what are ways, if for those trying to maybe like increase their income, how would they maximize their income in dermatology?
Most of medicine is still fee for service. There are dermatologists who are employed by HMOs like Kaiser, and so the salaries tend to be fairly set, and I think that their income is mostly based on how many clinics a week they see patients. And so generally the more patients you see in any setting, whether it's HMO or fee for service, is going to be greater if you see patients, let's say 5 days a week versus 2 days a week. So it really depends on how much work, effort you put into that clinical practice. But in our society, procedures tend to be rewarded more than in-office visits. And so dermatologists who do a lot of surgical practice, where they remove lots of skin cancers, for example, they tend to have higher incomes than dermatologists who do a purely medical practice, where they treat only with medicines and with injectables. So that's one way to do it. Being subspecialized in either dermatopathology, where you combine dermatology with being able to look under the microscope for dermatopathology, that tends to be very well compensated. And if you are a specialized type of surgeon within dermatology, it's called Mohs surgery, that field is very well compensated because it's purely surgical.
So surgeries and specializing.
Yes. Mm-hmm.
How, with all the advances in dermatology, you mentioned there's hundreds of different skin conditions to stay on top of. Mm-hmm. How do you stay on top of your field?
Well, like most specialists in medicine, there are several general ways. One is going to meetings within your society. There's something called the American Academy of Dermatology. They have a meeting once a year. They have many different lectures in different areas, and it's all you receive CME credits, continuing medical education credits, for doing that. And then there are journals, of course, that we receive or we subscribe to, and that keeps us abreast of the latest information. And for us in academics, we also write and publish. So when we publish something, we do research something, you almost have to go to the literature. You have to read the most advanced articles that are out there to see what other people are doing, incorporate that knowledge into your publications as you send them out. So in academics, we pride ourselves in a way on being more up to date on the clinical practices. But a good clinical dermatologist, no matter where they are, will know that they have to keep up to date to deliver the best care to their patients, no matter what the setting.
How do you prevent burnout, or what tips do you recommend to prevent burnout?
Oh, I think that to prevent burnout, one has to have other activities within their lives, and that could be virtually anything, whether it's family, whether it's some hobby or sport or favorite pastime, music, arts. There's so many different ways. I think what I recommend for anyone, really, any occupation, is that work is, for most people, is not the only thing that there is. So working too much and not leaving enough time for personal self-reflection and for other important aspects within one's life is a recipe for burnout, as you say. And so there often is as I mentioned before, the more you work in dermatology, the higher your compensation. And so what I recommend to people is that generally as a dermatologist in the United States, you will be well compensated. But you have to temper that with the ability to do those other things in life that are meaningful to you. And so I try to do that. I encourage our faculty to think about those times. And yes, you can earn more money by working longer hours, harder, seeing more patients. But at some point, it will detract from your ability to do other things that perhaps add additional meaning to your life.
So you mentioned a lot of dermatologists like aesthetic things like photography and art. Is that what you do for hobbies?
Well, I have several hobbies. Photography is one of them. I also like music. I play low piano. I also like sports. I play golf and tennis, and so I think I view myself as pretty well-rounded and enjoy going out and trying nice restaurants and meeting with friends. And so life has a lot of different aspects. Dermatology is only one of them for me.
Mm-hmm. How would you recommend establishing a work-life balance? That ties a little bit into the last question, but do you have any particular tips for that?
Well, I think that being able to say, to decide where you want to put that balance between work and family life or other life is a personal decision. And so you have to realize that. And sometimes it means saying no to working additional hours or other activities that, yes, they could increase your compensation overall, but I think there are also limits, and being able to say no, I want to be able to spend that time with my family is an important thing to be able to do.
How has medicine changed since you started, and where do you see it going the next few decades?
Since the years when I trained in the early 90s, I think medicine has made tremendous advances in understanding the pathophysiology of disease, and also based on that understanding, developing new targeted medicines that could only be imagined when I was a medical student. For example, in the disease called psoriasis, and it's a very common skin disease, we now have upwards of 10 biologic medications that are far more effective than anything we had when I was training in medical school. And that's simply based on the research that was done during that time and in the following decade. But now we have tremendous new medications. And I think the amount of knowledge we have is generally much greater. There's certainly much more to learn from medical students these days than medical students from my generation. And so I think all physicians are trying to keep up with that. And I think the other thing is artificial intelligence, being able to use resources that are on the internet and other places to either help make diagnoses or to transmit images of patients to doctors for teledermatology. So technology has changed a lot for medicine and for dermatology as well. So I would say those are the main areas, the amount of knowledge, and because of that, the number of medications that we have now, as well as technology changing the way we practice medicine.
Do you feel like AI will be able to replace doctors to some extent?
I actually think yes. I mean, there have already been software programs and artificial intelligence technology that can look at photographs and with fairly good, with meaning 75% plus accuracy, identify something as being benign or something that's potentially a skin cancer. I think where it's really going to be helpful, I don't think dermatologists are ever going to be replaced for that, because there's still a number of mistakes that are made, and many subtle cases that are not recognizable now by AI technology. But it might be helpful for general screening, where private practitioners or your family practitioners and internal medicine physicians, who are the primary care physicians for individuals, can use these technologies to get a better idea whether to send that patient to a dermatologist or not. And so I think dermatologists are always going to be needed to really personalize and tailor a treatment for that patient. But there's, to be honest, a lot of demand for dermatology, and we are not producing more dermatologists in this country. And as the number of individuals get older in this country, skin cancer will get more and more common. And I think that it's going to lead to a situation where people are going to have a hard time getting to see a dermatologist, particularly in rural areas and areas that are underserved in medicine in general. And so these technologies will allow those individuals that are far away from the typical academic center to get some idea whether this is a benign spot or a malignant spot, and give them some reassurance and start the process of medicine and make sure that those who really need medical care get to see a physician in a reasonable time, and those who may not need it can be reassured that they don't really have something that needs to be treated.
So you mentioned there's a demand for dermatologists, but at the same time, it's also very competitive. So is the barrier to getting more dermatologists the residency spots?
Yes. Residency spots are limited by a number of factors in the United States. I mean, there's only a certain number of what we call academic medical centers that traditionally have trained physicians, whether it's dermatology or other fields. There's only a limited number of those academic centers that usually have a medical school affiliated with them, like UC Davis. The other thing is that there are boards like the American Board of Dermatology and the ACGME, which regulates residency numbers. They have to make sure that whatever program that is out there is actually high enough in quality to be able to train good doctors once they're finished with that residency. So that tends to limit the number of spots. And there are only so many physicians who also want to teach in those academic centers or teach in those settings where they are working with residents. And so all those things tend to limit the number of physicians. The number of dermatologists that are trained in this country really hasn't changed a whole lot in the last 10 years. Just maybe a few dozen more dermatologists that are graduated in that period of time. However, the need for dermatologists increased perhaps by 30 to 50% in that period of time, given the aging of the population, and also the demand and desire of patients to look younger. So there's also a field of aesthetic dermatology where it may not be a medical condition, but it is something that patients want to see a dermatologist for, to make their skin look younger or to appear younger.
If you could go back, is there anything you'd change about your career path?
Actually, no. I think I'm very fortunate. I've had a wonderful career. I've had very good mentors and people I've really enjoyed meeting and learning from in my career past. So you can always speculate if you've made any major mistakes in your career. Fortunately, I don't think I've made any major mistakes. And the places that I've gone to, I've always been able to learn something from those individuals, and have been fortunate to have wonderful experiences. So I guess I would say I'm a very lucky individual to have had those experiences, and absolutely happy with dermatology as a career field.
And last question, what advice would you give us to become good doctors?
I would say that a couple of bits of advice. One is that no matter what field of medicine you go into, there is a tremendous opportunity to help someone. And again, no matter what that field is, do your best to learn about that field, to practice good medicine, and to practice ethical medicine. You'll find that in medicine, as most career fields, there's a right way to do something, and there's a way that may be a shortcut, or maybe not the right way to do that. And so to practice ethical medicine for the benefit of your patients, probably the biggest advice that I could give. One also needs to keep up with the medical knowledge, and it's becoming increasingly harder. So I would recommend people actually use the internet resources to be able to look up things sort of on the fly in real time, to be able to get answers to help your patients get better. That's about it. I know that this is an interview about dermatology, or maybe thinking about dermatology, but also realize it is a competitive field, and I think that I have tremendous respect for all the other branches of medicine. And so if for some reason you don't match into a dermatology program, it should not be a disappointment. There are so many other fields of medicine. I think I could have been equally happy being a pathologist or a different type of specialist. I think I would have gotten a tremendous amount of satisfaction practicing in those fields as well.
Great advice. Thank you again, Dr. Huang, for being part of this interview. Thank you guys for watching. If you have any questions about dermatology, you could leave it down below in the description box, or let me also know who you'd like me to interview next. Thanks for watching. Have a great rest of your day.
All right. Thank you very much.